Okay, this is Chapter 4 of Goodman called Environmental and Occupational Medicine. So, for intro, we have environmental medicine, occupational medicine, and the environment. Environmental medicine is industrial and occupational medicine and environmentally induced illnesses and conditions. So, basically, anything that we find whenever we're working and how that creates the illnesses. Occupational medicine is a specialty involving the health of workers and workplaces, considered special form of environmental medicine. So it's just taking it one step further and becoming more specialized. Then you have environment, which is all the agents outside the body, including infections, organisms, toxins, and food. The two companies that regulate environmental health are known as OSHA and Environmental Protection Agency. Environmental medicine takes into account the risk factors in the environment and human health and how they interact with one another. Environment exposes us to physical, biological, and chemical agents. So literally anything that we interact with can cause us potential infections or potentially diseases. Effects of environmental contaminants on children. So children are born with an immature nervous, respiratory, reproductive, and immune system. Children are going to be more exposed to these contaminants because they're outdoor more often, causing them to put their hands in their mouth more, engage in more dirty behaviors when they're messing around in the dirt or they're on the carpet. And they're also exposed with baby bottles, drink packages, and water bottles. Etiologic factors include short-term effects of air pollution, known through the eye, nose, and throat irritation, upper respiratory infections, headaches, nausea, and allergic reactions. The elderly, pregnant, smokers, and asthma are also predisposed to environmental conditions. Types of air pollution include indoor, outdoor, and water. So for indoor, the sources of that pollution are through tobacco, smoke, fireplaces, space heaters, stoves, pilot lights, gas ranges, mothballs, cleaning fluids, glues, and fabrics. From outdoor, the sources include ground level ozone, particulate matter, carbon monoxides, sulfur dioxides, and nitrogen dioxides. And from water, the sources include pesticides and industrial chemicals. Food can also be something that predisposes us to autoimmune diseases, chronic diseases, birth defects, autism, learning, and disorders. So within food, you might find pesticides, insecticides, and herbicides that cause conditions like dermatitis, asthma, GI issue, pulmonary disease, and cancer. And at-risk people for finding these potential infections in food are farmers or ag workers, as well as school-age kids, because they're the ones that are typically going to be interacting more with those dirty working environments. Chemical compounds include soil asbestos, which are found in automobile brakes, polynuclear chlorides, found in the plastic and medicine products, dioxin, found in fatty tissues of mammals, pyrolysis, wood, fire, bullets, and glass. That's where you're going to see lead. Then you have arsenic, which is found in fish. Mercury is found in the air, H2O, and soil. So, physical agents that we could be predisposed to include electromagnetic radiation, heat stress, and high altitude. So, for electromagnetic radiation, those are found in things like microwaves, ultraviolet light, X-ray, and gamma rays. And most common sources include accidental environmental exposure and medical, therapeutic, or diagnostic radiation. So they can cause different issues that potentially affect your CNS, auditory, blood-brain barrier, immunologic, endocrinologic, hematologic development, and your cardiovascular systems. Heat stress can result in heat-related disorders such as heat stroke, exhaustion, cramps, dehydration, and prickly heat. Older adults, during heat extremes, industrial workers, construction workers, firefighters, outdoor sports participants, ag workers, pregnant women, and people taking mood-altering drugs are more predisposed. So high risks are also elderly and young people and people with chronic medical conditions. So somebody with heat stress may present with thirst, muscle cramps, fatigue, dizziness or lightheadedness, as well as dehydration, disorientation, loss of consciousness, or emotional instability. So for high altitude, that's when you reach 8,000 to 14,000 feet. The atmosphere has decreasing partial pressure of oxygen and decreasing temperature. So acute altitude sickness, that's when you experience this immediately and your whole mental state's gonna change. So you have high altitude hypoxia as well as acute altitude sickness. And these are things that can happen when the lungs and arteries become constricted because of lack of oxygen in the air pressure, causing things such as shallow breathing, coughing, a frothy sputum, blue or gray lips and fingernails, chest tightness, and drowsiness. And high altitude cerebral edema, brain swelling severe enough to interfere with your actual brain function. Then the next category, occupational injuries and disease. 140 million workers a year are injured. Males under 25 have the highest workplace injuries. Weekend warriors are injuries to sedentary workers who go out on the weekend and participate in sports and other strenuous physical activities. Ergonomics is a study of work and relationship between humans and their working and physical environments. It deals with job design, work performance, health and safety, stress, posture, body mechanics, material and handling, equipment design, environment, and employment. Musculoskeletal disorders encompass cumulative trauma disorders, work-related disorders, and repetitive strain injuries. Work-related MSK disorders are any type of injury or disorder of the muscles, tendons, ligaments, cartilage, or spinal disc. Typically, men have more severe injuries than women. Risk factors occur with exposure to repetitive, static, or vibratory activities. They can also be genetic, morphologic, biomechanical, and psychosocial. Someone with these MSK disorders would present with decreased grip strength and range of motion, impaired muscle function, and inability to complete ADLs. Silver collar workers are older adults who have a decrease in injury risk than younger workers. Older workers' injuries are more severe with longer recovery times, and fertility of older workers are 3 times than younger workers. Physical therapists are also people who can experience work-related injuries. On average, 1 out of 6 therapists leave or change professions because of work-related disorders. 57% have MSK complaint. Low back pain, neck, shoulder, hand, and wrist are the most injured areas of the body. School system, other and private practice have increased disorders. PTs with brain injuries, stroke, and spinal cord injuries are most physically demanding. So actually, patients with these things would be the most physically demanding because they're not able to do a lot of things by themselves. Occupational injuries include burns, pulmonary disease, cancer, infections, skin disorders, and latex allergies. Military-related disorders are in 3 categories: Agent Orange, Gulf War Syndrome, and PTSD. So Agent Orange, that's the herbicide that was found during the Vietnam and Gulf War. People are at risk for diabetes, AL, chronic B cell leukemias, and heart disease, as well as cancer. Gulf War Syndrome is in the Persian Gulf War vets. It's an increase in ALS or Lou Gehrig's disease. Typical signs and symptoms include fatigue, skin rash, headache, sleep disturbances, diarrhea, and other GI disorders. Chronic fatigue, fibromyalgia, functional GI disorders, and undiagnosed illnesses. Lastly, PTSD is an anxiety disorder that occurs after seeing or experiencing a traumatic event that involves threat of injury or death. It occurs at any age. Reliving the event and avoidance are common, so somebody's going to experience the things over and over, or they're going to avoid them, and symptoms are present for at least 30 days. And that concludes Chapter 4.